A tape measure across the belly can reveal the problem before the scale does. Over 35 inches for women, or over 40 inches for men, is a warning sign that belly fat may be raising health risk. And after 60, that growing waist is often not just soft fat under the skin. It can be visceral fat, with deeper fat packed around the liver, pancreas, and intestines. That is why the old advice, just eat less, so often fails. The body at 65 is not the same machine it was at 35. Hormones have shifted. Muscle has quietly declined. Blood sugar runs higher after meals. Sleep may be lighter. Stress hangs around longer, and the cells that once burned fuel easily may not handle energy as well as they used to. So if your pants are tighter but your weight has barely changed, you are not imagining it. Something deeper may be happening. Visceral fat is not just a storage tank. It is active tissue. It releases inflammatory signals and is tied to insulin resistance, type 2 diabetes, fatty liver, heart disease, and possibly cognitive decline. That matters because this is not really about looking thinner in a shirt. It is about staying strong enough to travel, climb stairs, garden, get up from the floor, think clearly, and enjoy your family without feeling like your body is shrinking your world. A widening waist often shows up quietly. Maybe the belt moves one notch. Maybe the belly gets firmer while the arms and legs look smaller. Maybe a routine blood test shows rising fasting glucose, A1C, triglycerides, or blood pressure. Maybe you feel sleepy or crashy after a carb-heavy lunch. Maybe snoring gets worse, sleep gets worse, and the next day you crave more quick energy. A lot of people are told this is just aging, but aging is not the whole story. After menopause, lower estrogen tends to shift fat storage toward the abdomen. In men, lower testosterone is associated with higher body fat and insulin resistance, though testosterone treatment is a medical decision, not a casual fix. Chronic stress and poor sleep can disturb cortisol patterns, and cortisol can influence visceral fat cells. Then there is insulin resistance. When your cells stop responding well to insulin, your body has to make more of it to manage blood sugar. Higher insulin makes it easier to store energy, especially around the middle. At the same time, muscle loss makes the problem worse. Muscle is one of the main places your body parks glucose after a meal. Less muscle means blood sugar and insulin stay higher for longer. Aging-related changes in mitochondria, the energy engines inside your cells, may also contribute to poorer fuel handling. That does not mean your metabolism is broken. It means it needs a different strategy. And this is where severe dieting can backfire. If you cut calories hard, but do not protect muscle, you may become lighter and weaker at the same time. The belly may barely change, while your legs lose power and your metabolism slows. That is the wrong trade after 60. The better path is not punishment. It is targeted support. You want meals that lower the insulin burden, movement that uses blood sugar at the right time, and enough protein and fiber to protect muscle and control hunger. These are things you can start at home without waiting for a new prescription. The first thing that helps is a Mediterranean-style, protein-aware way of eating. Not a crash diet. Not tiny portions of dry toast. Think vegetables, lentils, chickpeas, black beans, extra virgin olive oil, nuts, fish, plain Greek yogurt, eggs, cottage cheese, tofu, and whole fruit. In older adults with overweight or obesity and metabolic syndrome, An energy-reduced Mediterranean diet, combined with physical activity, reduced visceral fat, and helped limit age-related lean mass loss. Start with protein. Older adults trying to lose belly fat need to protect muscle while losing fat. Good options are plain Greek yogurt or skyr, cottage cheese, eggs, fish, tofu, and lean protein foods you actually enjoy. A common evidence-informed protein range for older adults is about 1.0 to 1.2 grams per kilogram of body weight per day, though anyone with kidney disease should ask their clinician before raising protein. The simple version is this: put a solid protein source at breakfast or lunch, not just at dinner. Then add slow fiber. Aim for at least half a cup of lentils, chickpeas, or black beans 4 to 7 times per week. These foods digest more slowly, improve fullness, and help reduce the blood sugar spikes that push insulin higher. Oats and barley are useful for the same reason. Their soluble fiber slows absorption and supports better glucose handling. Use extra virgin olive oil as your main added fat, especially in place of refined snacks, butter-heavy foods, or processed dressings. Many Mediterranean-style studies use roughly 2 to 4 tablespoons a day total, but you do not need to measure perfectly. Use it on vegetables, beans, salads, or fish. Add 1 ounce of nuts most days if they fit your diet. Walnuts, almonds, and pistachios help with satiety and diet quality. Add fatty fish like salmon, sardines, or trout twice a week if you eat fish. Use whole fruit instead of juice or sweets. Blueberries, raspberries, apples, and pears give you fiber and polyphenols with better fullness than a glass of juice. The foods to reduce are just as important: sugary drinks, sweet tea, large juice servings, pastries, white bread, crackers, sugary cereals, chips, packaged sweets, and fast food combos. These foods are easy to overeat and often create the blood sugar swing that leaves you hungry again. Alcohol is also worth watching, especially nightly alcohol, because it can worsen sleep and add to fatty liver risk. The supplement category worth considering is not a fat burner. It is soluble fiber, especially psyllium husk. Psyllium works more like a food-based fiber add-on, and research suggests it can improve fasting blood sugar, A1C, insulin, and insulin resistance markers. Many products are used around 5 to 10 grams per day, with plenty of water, often before meals, but separated from medications because it can interfere with absorption. For people who struggle to get enough soluble fiber from food, a psyllium husk supplement can be a practical backup, and I put one option through the link in the description below. It supports the food plan. It does not replace legumes, oats, vegetables, or walking. The second thing that helps is movement timing, not punishing workouts. Timing. After you eat, your muscles can act like a sponge for glucose. A 10-minute moderate walk, about 30 minutes after a meal, has been shown to lower post-meal glucose, especially after dinner. If that feels like too much, break up sitting every 30 minutes with 2 or 3 minutes of easy walking. This is powerful because it attacks the insulin problem at the moment it appears. The third thing is muscle preservation. 2 or 3 strength sessions per week can help reduce body fat and visceral fat while fighting the muscle loss that makes belly fat harder to lose. This does not require a gym. Sit to stands from a chair, wall push-ups, step-ups, light rows, and carrying groceries can count if you progress safely. The goal is not bodybuilding. The goal is keeping the tissue that helps control blood sugar and protects your independence. Sleep is the quiet partner in all of this. Short sleep is associated with more visceral fat, and poor sleep worsens cravings, blood sugar, and stress hormones. Aim for 7 to 8 hours if possible. Keep a consistent wake time. Reduce heavy late meals and alcohol. And if you snore loudly or feel sleepy during the day, ask about sleep apnea. One important caution: rapid belly swelling, unexplained weight loss with a larger looking abdomen, chest symptoms, shortness of breath, leg swelling, blood and stool, severe fatigue, extreme thirst, frequent urination, or very high home blood sugar or blood pressure should be checked by a doctor. Do not assume every belly change is fat. But if this is the slow, familiar waistline creep that comes with age, you have more power than you may think. Measure your waist this week. Take a 10-minute walk after lunch or dinner. Add one protein-rich meal. Put beans, oats, or Greek yogurt into the rotation. Do 2 short strength sessions. You are not trying to punish your body smaller. You are teaching it to handle fuel again, protect muscle, and move visceral fat in the right direction.